HHS Secretary and FDA Director had a press conference about lowering the cost of prices for drugs in the United States of America. I'm actually surprised at the amount of work that the Trump's administration is doing in relation to the cost of drugs in the United States of America. And having watched everything that they are doing, I'm actually fully convinced that the problem in the United States of America is the pharmaceutical companies. Someone as a conservative who is a free market person who believes in free market capitalism, I am very weary of the excesses of capitalism, especially when it comes in the forms of monopolies and or duopolies or concentrated forms of market power that tend to hurt the customer. And this is what has been happening in the United States of America. You're having these pharmaceutical companies who are hurting the customers or who are hurting Americans. A big part of that is that these pharmaceutical companies, because there's a handful of them, it's like 4 or 5 of these companies, they operate in every country in the world. I mean, one of them are well known, obviously. There's Medun, there's Medina, there's Johnson and Johnson, there's AstraZeneca, other names I forget right now. They're everywhere. They're in Europe, they're in the States, they're in Africa. And they control almost like 80% of all the drugs that we consume or we use. That includes surgical drugs. And what happens, especially in the United States, is that in the past 40 years, they've been overcharging American customers to subsidize other countries in terms of why they are charging other countries the low drug prices that they've been charging in areas like Canada, the United Kingdom, the EU. And people wonder, why are they charging such low prices in Europe, what they are not charging those prices in the United States. What actually they are doing is they are cross-subsidizing their drugs. That is a very common thing that pharmaceutical companies do. And no one has a problem with these pharmaceutical companies cross-subsidizing in terms of charging lower prices in poor countries by charging more in richer countries. The problem is when they are charging the United States like 5 times, 10 times, even 20 times more than what they are charging in the EU or in Canada. That's a problem. And President Trump is dealing with that problem. Problem number one. And once the problem has been done with the contract that was signed with Pfizer, and Pfizer is also under them, then a lot of these prescription medication prices will go down by more than 50%, sometimes 80%. But also one of the problems that come with these is that many of these life-saving medications, which are known as biologicals, are held by these companies under a patent, an exclusive patent. And these companies then tend to charge whatever they feel like charging. And the problem is that even after the patent has run its course and has expired, they tend to apply for a renewal of that patent, and then they continue to exploit the customers for 20, 30 more years. So what tends to happen though when a patent has lapsed, there are medicines that are called biosimilars, which are medicines that are organically, if you're talking about organic chemistry, because these are just very complex organic substances. You have medicines that are called biosimilars, who are similar to the biologicals in terms of structure and the entire organic structure, including the reactivity. And so one could argue that these biosimilars are actually isomers of these biologicals. Similar in action, similar in potencies, similar safety profiles. And these biosimilars are used as cheaper generic drugs to replace these biologicals, which are often held under strict patents by these pharmaceutical companies. And that is what the President Trump's administration is currently now trying to do in terms of removing red tape that prevents these generic biosimilar compounds from being actually produced and brought to market in order for them to provide cheaper alternatives of the biological medicines that are held by these large pharmaceutical companies. Also, what tends to happen with these large pharmaceutical companies is that if a smaller company comes up with a drug, a potent drug that does something, let's just say it treats cancer, and they can see that this is a good drug, what they tend to do is that they acquire these smaller companies, which has tended to stifle innovation as opposed to help with innovation. And it also makes these larger pharmaceutical companies lazy in their R&D endeavors and their R&D efforts. And all of this consolidation that comes with them buying smaller pharmaceutical startups also goes into the issue of hurting customers. Customers having to pay higher prices, even though these pharmaceutical companies can, in fact, charge lower prices by utilizing their economies of scale. But pharmaceutical companies are not interested in utilizing economies of scale in order to lower prices for the customers, because medicines and life-saving drugs are so critical for people who are in life-threatening situations that they are willing to pay anything to get access to these drugs. And so when you're having monopolies or close to a monopoly situation in a sector that is critical for people for life-saving efforts, you end up having situations where you have large swaths of life-saving drugs being entirely unaffordable for most Americans. And many of these mergers and acquisitions that happen in the pharmaceutical space they actually violate many of these anti-competitive laws that exist. So what I think should happen here, it's not just with the FDA, but it's also with regards to Congress, where many of these pharmaceutical companies are actually supposed to be forced to break up in a similar way that US Standard Oil was forced to break up 100 years ago. And the reason why these pharmaceutical companies, if they will operate in the United States of America, are supposed to be forced to break up is because their conduct in the past 50 years has consistently shown to be hurting Americans. And in my particular instance, I don't have any problem with monopolies or duopolies or monopoly-like situation, as long as those monopolies are not hurting customers. But in this particular instance of the pharmaceutical industry, pharmaceutical sector, these monopolies and duopolies and very large companies who control more than 80% of the space of drugs have been repeatedly and consistently hurting American customers. And on that basic premise alone, they are liable to be broken up. Because if monopolies are hurting customers, then they have to be broken up. And so then the problem then that you face on the side of Democrats is that they look at the situation, they look at the unaffordability of the life-saving drugs that Americans need, and they think to themselves, all we need is a one-payer system. And the problem with this, all we need is a one-payer system, is that it makes a bad situation worse. Because you still need to buy these drugs at these prices that are not at all related at all to anything that is market related. But now you are buying them using taxpayer funds. And the only way that if you're having a one payer system, you can actually be able to help customers in that situation is if you're gonna concurrently pass price control laws to control the prices that these pharmaceutical companies are charging their customers. But if you are not passing price control laws, or you are not nationalizing these pharmaceutical companies, your raising of taxes to of income taxes on this one side to create a one payer system is actually not going to lower prices, just as we saw with Obamacare. Actually, what it does, it increases prices, because what you're going to do, you're going to have these supposed subsidies. Say a drug that Americans take, a chronic drug, maybe costs them $100 per month, and then the government goes into that and say, okay, we're going to provide a 50% subsidy for that. Immediately, what the pharmaceutical company is going to do, it's going to increase their price from $100 per month to $150 a month. And then now what you are doing is that the government is no longer providing $50 in subsidies as they were supposed to initially, but now they are providing a $75 subsidy. And it doesn't stop there. It keeps on going up and up and up. And then a drug that was normally, before the government intervened, was like $100 per month, is now costing at around $300 a month. Some of these increases in drug prices far outstrip inflation in ways that are just unexplainable. That the only explanation is that the government intervention, like Obamacare, Affordable Care Act, has actually made the situation 10 times worse. That is what I think will happen if these suggestions that are being suggested by people like Alexandra Ocasio-Cortez or guys like Bernie Sanders, because unless you concurrently, unless you pass laws to control the entire healthcare system, including a full government control of pharmaceutical companies, then your one payer health insurance system is going to make the price of healthcare 50 times worse. The only way that your one payer health insurance system is actually going to lower prices and make prices affordable is if you control everything. And for you to control everything, you need to violate all kinds of American principles. And it's going to cost you so much money. You're going to raise taxes. People will effectively be taxed at like 65% effective tax rate. That will be the only way we're going to control this runaway train. And that's the same thing that we've seen with education, higher education in the United States, in particular when the government got involved in the early 80s. This approach that is being followed by President Trump's administration is probably the best approach that the United States of America could follow to lower the prices of healthcare. And they are just dealing with the issue of drug cost on the pharmaceutical side. We have not even gone to the issue of the many problems that exist in private hospitals. All of the pricing, price discrimination that happens when they charge different customers different prices for the same procedure in the same hospital being conducted by the same doctor or the same team of surgeons. And all the reasons why they do that is that they charge customers based on the perceived ability to pay. All of it is so like below the pale and just unethical and a way of extracting maximum profit. So once you look under the hood in terms of what is happening in a private healthcare space, and this is not just in the United States of America. I mean, even if you look in terms of the private healthcare space in South Africa, I think in South Africa there's like 3 or 4 private hospital groups that control 80% of all the private healthcare space, and the amount of collusion and unethical pricing and unjustifiable pricing that happens in that space, it's beyond belief. And also the issue that is happening in the private healthcare space is the issue of a lack of transparency in terms of pricing, where people often get surprise bills for operations or procedures that they underwent. One of the things on the side of the private hospital space is that people need to be told how much an operation or a procedure is going to cost them before they agree to doing it, so that they can be in a position where they can compare prices by going to another practitioner to say, how much will you charge me for this procedure? And because this thing is currently not happening, private hospitals continue with this surprise billing that ends up, a lot of Americans have declared bankruptcy because of health costs that were due to the surprise bills that come after a procedure has been performed. So this is to say that there's so many problems in the healthcare space in the United States, many of which come from the issues of monopolies. Which also means, because I think that pharmaceutical companies need to be broken up, number one. Number two, a lot of these private hospital groups in the United States, they too need to be broken up. The amount of concentration of power that exists in that space is one of the things that are contributing to the kind of pricing that is hurting Americans. Yeah, so that's really what my thought process is on that. And obviously that's not be the full story of what's going on with healthcare. The main thing that will make people be able to afford their healthcare is if they can get good paying jobs. Good paying jobs is actually the one thing that will prevent people from being bankrupt because of healthcare costs. But that's one piece of the puzzle. The other piece of the puzzle is to fix the structure of the healthcare sector. The healthcare sector, not just in the US and in South Africa, but also in Europe, is like a mafia. It is really bad. The amount of shenanigans that happen in the healthcare sector are actually unethical, and it is amazing the level of unethical behavior that happens, considering the oath that they swear of doing no harm. It's actually quite incredible. Anyways.